I'm Haresh Mehta, Director of Cardiology, Department of Cardiology at SL Raheja Fortis Hospital. Today we are going to speak about the first 10 minutes of a cardiac arrest. As we know, cardiac arrest means there is cessation of heartbeat. This patient is presumably dead because there is no pulse, no blood pressure, and the first 10 minutes are very vital. Now this depends whether he has had a cardiac arrest at home or he's had it in a hospital. If it is in a hospital, it's perfect, we know what to do. But if it is at home, I'll tell you what you should do. The first thing, anybody witnesses a person who's fallen down or is unresponsive, then look at the pulse which is around the neck, which is called the carotid pulse. Feel it. If you can't feel the pulse, means that his heart is not beating or is beating so fast that his pulse is not perceived. At this time, you have to start CPR, which is called cardiopulmonary resuscitation. So you have to compress his chest, which is in the center like this, using two hands. So push the chest down and release the chest. This has to be done at 100 to 120 times in a minute. And always at the same time, call for help so that by the time the paramedical or the ambulance can come, you should do CPR. And always have someone else with you who can help you doing a CPR. Many Western countries have defibrillators or shock-giving machines in multiple areas, in shopping malls, on the traffic lights, or even in apartment complexes. If that is accessible to you, you should shock that patient. So my recommendation to people is that everyone in the country, everywhere should learn basic CPR. Go to the nearest hospital, catch hold of the hospital to arrange a CPR class for people in your vicinity to learn CPR. But that's one that can save lives. So this is my message to you for cardiac arrest if it happens outside the hospital. But in the meantime, see that the ambulance is being called for, cardiac help is called for, and the patient should be shifted as soon as possible. Remember, to the nearest hospital. Don't try to go to far off hospitals. Go to the hospital which is nearest where you can get immediate aid. Now this is what happens outside. Now what happens if it occurs in a hospital? So we clearly have a protocol. If you have a person who is collapsed, most hospitals have something called a code blue. So they alert the CPR team. There's a specialized team which immediately reaches there. They assess the pulse, they assess the blood pressure, they assess the rhythm because they have everything. They collect the ECG and see what is going on. And they start immediate compression, which we spoke about. But here there are different things you see. There's one, you see circulation. Circulation means the pulse, the blood pressure. Then you see something called breathing, whether the patient is breathing or not. If he's not, then we can do something about it. And third is try to locate the cause of the cardiac arrest. The most important thing first is to get the circulation, get the breathing back. Circulation comes with CPR, which I told you. We do the same CPR. In between the CPR, we introduce drugs intravenously to get the pressure out or make the heart to beat. And in the meantime, another person who's trained enough starts ventilating the patient by putting a mask on his nose and mouth and giving oxygen through a ambu bag. If required, putting a tube into his trachea so that the breathing can be done through a ventilator. And third is to give drugs. So there are multiple drugs to raise blood pressure, drugs to control the heart rate, or the heart rate is zero. So if the heart rate is zero, we give atropine. If the heart rate is fast, then we give cordaron or lignocaine. And if there is no pressure, then we give something called adrenaline or epinephrine. And besides this, since your ECG is connected, we have a defibrillator, the same one which I spoke about. So you recognize the rhythm. The rhythm is ventricular fibrillation, which is an extremely fast heart rate. It can be immediately reverted by giving a shock. Once you have revived the patient, you've got some pressure, you've got some rhythm back, then you should do immediate analysis of the cause. And the commonest cause we have is either a heart attack, which can be seen on ECG and an echo, or there can be something called clot in the lung, which is called pulmonary embolism. For that, you can easily do an ECG and echo. Again, you have the diagnosis. Sometimes it can be pneumothorax, where the lung in patients with bad lungs or COPD, which have got bad type of asthma, their lung can suddenly collapse and cause air in the chest space. That can be diagnosed by the stethoscope just putting a needle inside the chest cavity will get him all right. Sometimes it can be an air traffic accident or an accident on the road where there's a lot of bleeding happened in the abdomen or somewhere else. We can quickly detect this and start giving blood. So all these causes, once they're detected, should be corrected. And once the patient is stabilized, it is shifted to ICU for further management of blood pressure, of the pulse, of the breathing, and of course, treating the cause. So if it is a heart attack, you take him for an urgent angioplasty. If it is pulmonary embolism, then you take him to the cath lab and remove the clot from the blood vessel of the lungs. And if it is an accident, you locate where the accident and may need emergency surgery. Very rarely it is infection, so you give antibiotics. So this is the first 10 minutes. Why these 10 minutes are important? Because within the first 2 to 5 minutes, if your brain is deprived of oxygen, the brain starts dying. So after that, even if you manage to get the heart rhythm back, you may have lost the battle because the oxygen to the brain, if it's gone down, you may have a heart back, but the brain may be dead. So CPR has to be quick, immediate, and organized.